if you feel that something is happening in your body and it doesn't feel good and it doesn't go away, for instance, with my lower back, my first surgery, I kept waking up every day. I thought, before I put my foot down on the floor, I thought, today will be the day I don't feel it. Well, it just continued. It never went away. I lost friendships over the decision for surgery, which was minimally invasive at that point. So to get back to your question, people first need to follow through, then they need to go get a consult, and if they don't like the information that they get because it's vague or doesn't really give definitive answers, they need to continue. That's what I love about dynamic health. I knew my neck and shoulders were giving me issues, so we did x-rays. They did a consultation. They went over everything with a fine-tooth comb, let me sort of know where I'm at. I elected for the stem cell procedure, which I call it shoring up my body, strengthening it, and it's sort of like a maintenance plan for me personally the rest of my life, as long as I'm alive and they are in business. That's what's going to happen. And my neurosurgeon completely embraced it and gave me a pretty decent report, and I think it has staved off surgeries because of what I've been doing. So anybody who might have fibro, lupus, whatever it is, an old injury, whether it's a car wreck, sports related, whatever, follow through, get those consults, get those MRIs, get those x-rays. And even if people don't have insurance, health insurance, they give discounts. So it's totally affordable. And you can make payments. And so many people don't go because of those two reasons, and that is not acceptable. So once you have answers about your body and your health, then you can make better decisions, more informed decisions, and find the options to go forward to help bring the quality of life back. Because people with fibromyalgia at home, exhausted, okay, functioning and taking care of daily things, that's my exercise. I don't exercise, but just living and taking care of everything, that's become my exercise. And now, because I've done a lot of groundwork and I have a better foundation with my body and I'm feeling better, I'm not there, but I'm the closest I have been in a long time. And then once you get a few levels up, then you can start to do the things you love again, like riding bicycles and feeling like a 12-year-old, but being very careful that you don't have a wreck, so you have more work for dynamic health. You come in to dynamic health, you feel this dynamic force. And what is so awesome about dynamic health, because they're not just the body and its function and sort of addressing injuries or illnesses, they take into account total whole health. So they are also about nutrition. They're about, you know, hydration, about all the things that it takes, because it's like making a soup to get well. And we have to have chicken noodle soup, but we also have to have all the right ingredients in order to achieve where you can finally go up a level in your health. So dynamic health is definitely takes the frustration and anguish out, because they give you answers almost immediately. There's support, and they are here to help educate people in ways that a lot of doctors just want to give you 5 pills, you know, and send you off to these different doctors. And unless you're doing the homework along with what they're telling you and understanding and really developing that, it can be very much a journey that almost seems hopeless at times to feel better. And I really thought I was going to end up in a wheelchair about 5 or 6 years ago. That's really what I thought. But in paying attention, going to the doctors, getting all the information, and then electing personally to come and do more, because I wanted to have a life. I didn't want to feel like I'm a 90-year-old when I'm was in my late 40s. I'm 51 now, and I feel like I'm, 30 something, sort of. I do know my limitations, and that would be the last important thing is when people do have illnesses or injuries, they need to understand to go at their pace and to listen to the doctors, follow orders, and do the physical therapy. That it's so important. Like, people just sort of blow it off, and it's one of the most important things to get your mechanics of your systems all working together and properly so that you're one again.